Hello and welcome to Quick Anatomy Hub. In this tutorial, we will talk about the supination and pronation, which are special movements involving forearm, and we will also discuss the inversion and eversion of foot, with reference to normal anatomical position in which a person should stand erect with palms and toes facing forward. Coming to the supination, when radius moves laterally or outward so that palms faces forward or upward and the thumb is pointing away from the midline. This is called supination. In contrast, pronation is opposite. The distal end of radius rotate over the ulna medially in a way that palms faces backward or downward and thumb towards the midline, as you can see in this picture also. Inversion and eversion are special body movements that turn the sole of foot towards or away from body's midline. During inversion, the bottom of foot turns that it faces towards the body's midline, as you can see in this picture. Its inversion starts with in, giving a hint that sole is pointing inward or medially. While during eversion, opposite movement occurs when the bottom of foot turns and faces away from body's midline or laterally. This is called eversion. The word evert means turning outward. So here is a quick review of what we have discussed. The supination is when the palm faces upward or forward. The pronation when palm faces downward or backward. The inversion is when the sole of foot faces medially or towards the midline. And in eversion, the sole of foot turns laterally or outward. So this is today's class. If you have any question, you can comment below. Thank you.